Good morning, everyone. We'll give about 1 more minute for folks to come in. Amazingly, we had over 800 people registered for today. So very excited about that. And thus it'll take a second for all folks to be kind of shuffled in from the waiting room. Good morning, Maria.
Good morning.
Lovely. Hi, Melody. Good morning. Oh, look at all the folks in the chat. Good morning, everyone. Hopefully it's sunny where you are. I'm in LA County. It's a little gray this morning. All right. Well, we are over 400 people who've made it in so far, and I imagine those numbers are only going to keep climbing, which is incredibly exciting. So I'm going to get us started. We've got a wonderful full-packed day for everyone, and so I want to make sure we have time for all of our presenters and everybody who's taken the time to be here today. So good morning. My name is Sarah Lacroix, and I'm co-lead for Strategies TA. I'm with the Children's Bureau of Southern California, and along with our partners at the Child Abuse Prevention Center, Strategies TA provides support throughout the state to prevention planning teams and counties with regard to moving upstream to support children and families. Welcome everyone to the 2023 Statewide Collaborative Prevention Convening. We're thrilled to be here with all of you together today to share best practices, our collective wisdom, and of course that's for the betterment of the resilient children and families that we all support each and every day. Before we get fully started, I want to take a minute to just thank the 30+ members of the statewide convening planning team who've been coming together since October of 2022 to make these next 2 days of learning possible. This year, we had the most robust, diverse, and cross-sector planning team to date, with representation from parents with lived expertise, tribes, various county and state departments, state associations, child abuse prevention councils, and community-based organizations. We sincerely hope the program today and tomorrow are supportive of your efforts to create change, and thank you all for being here. Next slide, please. All right, just some housekeeping for today so we can all have the best experience possible. Please mute your microphones. So we're on Zoom large meeting, so it's not a webinar. So we ask people to please mute your own microphones. If you have any questions or comments, please put them in the chat box. All of the presentation materials are now available in the shared Google Drive. They'll be, I think it's going to be put in the chat shortly, and they'll also be sent out after the event. And we do kindly ask that everyone complete the evaluation survey at the end of the session today and tomorrow. Also, if you need tech support, please put your request in the chat, and one from our tech team will reach out to support you. We have multiple people supporting, so we just ask it's okay to put it to everyone here, and one of the tech team will reach out to you. Okay, next slide, please. Good morning, everyone. Okay, I wanted to just review some of the collaborative convening objectives for today. So the 4 areas that we really wanted this to support teams with the most is providing support to prevention planning teams to begin their shift from planning to implementation for the Family First Prevention Services Program. To provide support to prevention teams in the various stages of building their comprehensive prevention plans. To learn from other CPP teams about their innovations and lessons learned around involving community, tribes, and those with lived experience. And finally, to provide teams in each county with an opportunity to build their mutual connections as a foundation for sustained collaboration. Next slide, please. All right, so let me give a little overview of our agenda for today. So we'll now hear from this morning, welcome from our convening planning team and partners, followed by our tribal engagement panel, our lived expertise panel. We'll take a 10-minute break to stretch our legs and then go into our 70-minute workshop. So we do have 11 workshops available today. We'll then hear from the Prevention and Early Intervention, the PEI Committee on recommendations, and finally our closing in the last few minutes. So workshop descriptions can be found in the Google folder that's been put in the chat. So you all will be able to see them there, and we'll review them before people are going into their breakouts as well. All right, next slide, please. Okay, so one thing we'd really like to know today is who's in the room. So we'll have a poll that's going to be popping up. And if you can please take a moment to select which of the roles most closely describes what you are, who you are and what you do. So I think that should pop up shortly. There it is. So which of the following most closely describes your role? Wow, we have 521 people here today. Incredible. All right, so it looks like we've got a good number of folks from child welfare, child abuse prevention councils. I see community-based organizations. Good deal of other folks here from, I imagine, different sectors, education. All right, wonderful. You can go ahead and end the poll. Okay. So great. I think as imagined, we have a good number of people from child welfare, community-based organizations, and it's super exciting to see so many child abuse prevention councils here today. Thanks everyone for doing that. Okay, next slide, please. All right, wonderful. So I am very pleased to introduce Oriana Walker, who is the ICWA director for the Picayune Rancheria of the Chukchansi Indians. Oriana has been a part of the statewide convening planning team these last few months and brings a wealth of knowledge, ideas, and generosity. Her passion for foster youth advocacy began while working in a group home as a house manager, and she's always had a heart for children and being their voice when no one else would listen. In 2008, Oriana was honored with a position within the ICWA department where she learned Indian child welfare law. She has many great mentors along her journey, and as a Native American woman, she intimately understands the adversity that many Indian families face today. Some of her goals include educating families on how historical trauma affects current actions and how to heal, advocating for youth going through the child protective system, engaging in helping different counties and states understand the importance of ICWA, and most importantly, preventing the breakup of not only families, but of tribal communities. Oriana has been so kind to offer a tribal blessing for us all here this morning. So Oriana, I will turn it over to you.
Hi, good morning. Thank you. Wow, 542. Yay, that is so awesome. So yes, my name is Oriana Walker and I hold many titles. But today I'm here and I'm honored to be wearing my ICWA Advocate Director hat. And I come to you today from the ancestral lands of the Yokut, Chukchansi, and Mono peoples. I want to offer a moment of silence to honor those past tribal ancestors, people, children who lost their lives, who were punished for practicing our traditions, speaking our language, and never had an opportunity that I have today to be here in this circle. I ask you to join me in a moment of silence just to honor those. Thank you. Thank you. I want to open today with a blessing, a prayer. So prayer in your own way as your own beliefs. But I offer this for us today. As we move forward today, I want to thank Creator for our health, giving us the safety and security that when we woke up this morning, that we felt in our warm beds that many don't have. I want to thank Creator for this beautiful day and for all the riches that He gives us. I ask Creator to help guide today's conversations, and that our conversations will help provide resources, services for the underrepresented and the underserved populations. I pray we have open minds to truly focus on the work that we do and that we have done. And I pray for those that have traveled on, that their journey is a safe one. To all my relations. Oh, thank you. I was asked today to also, you heard me earlier speak a little bit about a land acknowledgement. So if we could go to those slides. So you heard me say a land acknowledgement. So what is a land acknowledgement? A lot of agencies recently have been doing land acknowledgements and acknowledging the land that they are on. The importance of a land acknowledgement is to just really give respect to those ancestors and the stewards of the land that were here before us. Land acknowledgement is a traditional custom that dates back to centuries in many Native nations and communities. Today, land acknowledgements are used by Native peoples and Native and non-Natives to recognize Indigenous people and who are the original stewards of the land. When doing a land acknowledgement, it takes a little bit of research to understand what the community was, who it is, and maybe what the traditions and the customs of those people were. Making a land acknowledgement should be motivated by genuine respect and support of Native peoples, truly wanting to understand the Native community and who was here before. Speaking and hearing words of recognition is just as important step in creating the collaborations, being accountable, continuous and respectful relationships with Indigenous nations and communities. So it's really just having an understanding of the population that we are serving. Next slide, please. So tips for creating a land acknowledgement statement. Start with self-reflection. Why are we doing this land acknowledgement? What is our end goal? It's going to take some research. You could just hop online, do land acknowledgement. A lot of information will come up with Google. Very nice, Google. Use correct pronunciation of the names, tribes, places, and individuals. If we don't know it, it's okay to ask. It's okay to reach out to someone else and, just ask what the pronunciation is. Use appropriate language. Don't sugarcoat the past. We all are aware of what happened in the past. And in order to heal from that past, we have to acknowledge it in order to move on. And take action. Land acknowledgement is just not enough. It's just a starting point. It's just a starting point, an entryway into understanding the Native community that is in your area. So thank you today for having me. I appreciate it. And I feel very blessed.
Ariana, thank you so much for that. Really, really appreciate your generosity for starting us off on the right foot today. All right, next slide, please. All right, I have the also wonderful honor of introducing Roger De Leon, who's been part of our planning team for this convening today and will be a part of our welcome. So I want to share a little bit about Roger with you before he gets started. Roger is a dedicated father, grandfather, minister, and passionate advocate for children and families. Roger is an independent contracting instructor, for the UC Davis Resource Center for Family Focused Practice, the CWDS CRA academies at San Diego State University and also UC Fresno. Roger helps to develop and deliver state-mandated trainings throughout California. He's worked as a parent partner with Riverside County Children's Services Division for the past 8 years before recently resigning. He was one of the first parent partners hired and helped develop their program. Roger is a birth father representative on the California Child Welfare Council and co-chair to the new task force for band-aided supporting, and served as a member of the Parent Partner Advisory Committee. He uses his personal experience of successfully navigating the child welfare and court systems to inform his work. Roger is a member of the Children's Trust Fund Alliance Birth Parent National Network and has worked in collaboration with Casey Family Programs on strengthening families through the American Rescue Plan Act and Parent Partner Learning Collaborative. He provides consultation to the U.S. Department of Health and Human Services. And lastly, Roger is the recipient of the 2023 Casey's Excellent for Children Award, Birth Father of the Year. Wonderful, Roger, welcome.
Thank you for that introduction. It is a pleasure to be here with you all, and being a part of this planning committee is something that has really tapped into a passion of mine. Being able to introduce and welcome everyone, it's just amazing to see how many we have online today, and just know that we are going to have a wonderful time today. So hopefully you're ready. And this year I was asked to be able to, bring the introduction as a father with lived experience, especially because we want to change the direction and how we do our practice and how we develop. And so I know that, being here to be able to speak on behalf of individuals with lived experience, I am just a small portion of many who are out there who bring such a wonderful genuineness of what it's like to navigate, right? And so I'm privileged once again to be with you all, to be able to have these wonderful conversations. And I look forward to seeing the wonderful impact that we're going to be having in changing the direction and how we do things. Now, one thing I will share is that we're not here to, get rid of anything, but how we can come together to develop stronger ways to help families within our state, and how we can go forward in every aspect, going and being inclusive. And so my heart and hope today is that we are all open together and going forward to develop, to grow, and to even be open to different ways and perspectives on how we do our work going forward. And so once again, I thank you for this privilege to be able to be here. And I call it a team effort with the ability to be able to receive an award, but I could not have done it without a team, which I'm happy to be a part of this one. And so I look forward to working with you all in all different levels, one way or another, whether it's in the same room meeting together and having those wonderful, genuine conversations, or developing different plans and policies and so on to be able to better our work going forward, and being very inclusive with every aspect of our community that is very much needed. So with that, I thank you for this time and this opportunity to be able to speak and basically bring in everything that we're going to be doing today. And well, let's get started, shall we?
Yeah, wonderful, Roger. Thank you so much. I have the pleasure, let's go to the slides. Thank you. I now have the pleasure of introducing Cheryl Treadwell, who has 22 plus years of career experience at the Department of Social Services and the Children and Family Services Division on several programs and initiatives that impact providers, resource families, foster youth, and tribes. In April of 2021, Cheryl was appointed as the Chief of the Safety Prevention and Early Intervention Branch, which is organized to focus the state efforts on the front end of the child welfare systems continuum, including primary prevention. Her education spans both the social work and legal field, along with her extensive experience working in the community and in human services for more than 30 years. Ms. Treadwell has represented the Department of the California Behavioral Health Planning Council and is currently co-leading the division's Racial Equity Work Group. Cheryl has worked closely on several initiatives over the years, such as wraparound, systems integration, advancing the development screening of young foster children, continuum of care, working with tribes, and implementing California's first federal child welfare waiver demonstration project. Welcome, Cheryl. So nice to have you here.
Good morning, and thank you. And thank you, Roger, and also for the blessing. It just sort of set the tone. Thank you all for your time and commitment. This effort has been months in the planning to get to this day. And so what I expect you to bring is bring in your motivation, bring your inspiration, bring your hope. You know, we need to be dealing hope, you know, in these times, our communities need more hope. And I want you to think more about being inclusive, building those bridges with our families. We have some great workshops. And so you can only get out what you put in. And so I expect great inputs today for us to continue this work. I think working together for the good of our safety, for our children and our families is an exciting opportunity, and understanding that change takes time. And that's always an added challenge to keep partners at the table. But this, to me, is monumental in the sense of we brought as many partners together as we could think of. And so I'm delighted to see over the next 2 days what comes out of this work to jumpstart this whole conversation around prevention. So thank you once again for the team that put this together and for the participants. And on that note, I would like to transition to introduce Angie Schwartz, my boss, and she's the Deputy Director of our Children and Family Service Division at Social Services. Angie has been a leader for several decades in the child welfare space. Since she's come on board with us in 2021, she's focused the priorities of our division in several main areas, overseeing an array of services for children and families. She is primarily focused in the realm of the kin family work. She'll tell you later on some of the exciting work that we're doing. In her prior work, prior to joining CDSS, many of you may know that Angie was an advocate working at the Alliance for Children's Rights, the Public Interest Law Project, and the National Center for Youth Law. So I am truly glad to have her on board with us on this side. Angie used to be the advocate. They used to like keep us really straight in our lanes. But I have been appreciative of her leadership. And so at this time, I'll turn it over to Angie. So thank you for this morning and welcome once again, everyone.
Thank you, Cheryl, for that lovely introduction. And good morning, everyone. I want to deeply appreciate all of the speakers that have welcomed us and blessed us this morning. And I just really appreciate the energy, and Cheryl, particularly all the energy that you and your team have brought to all of this effort for the whole time since I've been within the department, and even going back to that time as an advocate that you mentioned. I want to welcome you all from the ancestral lands of the Miwok, Maidu, and Nisenan tribes, and appreciate again the blessing this morning and getting us off to the right start as we start today's events. We have over 500 participants here today, which is extraordinary. It's a testament to the commitment and dedication all of you have to the work that we are doing to improve the lives of children, youth, parents, and families across California. I'm delighted that there are so many people from so many different sectors: professionals, tribal members, youth and parent partners, practitioners, policymakers, researchers. Can't forget the advocates. I come from the advocacy world, gathered here today to discuss and explore ways to improve the well-being of our children, parents, and families. And most importantly, I'm honored to be with you as we are working to learn and listen and grow from the valuable insights and experiences of those with lived experience and of our tribal representatives. Our 5-year prevention plan, you may know this, was approved by the Administration for Children and Families on April 7th, so just last month. So we are moving into the implementation phase, and this is a big piece of that. This significant investment, in addition to the significant investments that we've made as a state to advance California's revolutionary approach to providing children and family support and to prevent and support families before they ever touch our foster care system. That's the objective of the Family First Prevention Services Act. It's to enhance supports and services, to partner with families in order to prevent entry into foster care, also to reduce reliance on congregate care, and make sure that all children that are within our system are cared for in loving and stable homes by people that they know and that they're connected to. So during this convening, we'll be hearing from experts in the field who will provide context and research, best practices to support the development and the implementation of prevention services, really centered around the voice of those with lived experience. I mean, prevention is really about serving community and strengthening community, and you can't do that without really listening to those that have experienced our system, and then also what our families who are experiencing our system really need from us. I encourage you over the next 2 days to be open to learning from others about those innovative practice and the lessons as we embark on this next stage and we move from planning the Family First Prevention Services Program in California to implementation, where the real work really begins. It's essential that we continue to share knowledge across counties and ensure that we're all working towards the same goals and learning from each other's successes and challenges. We want to hear that from you all as the states, that we can help to overcome those challenges, and we can sort of think through the specific ways that those challenges present in different regions and our rural counties versus our more urban centers. So please continue to share that with us as well. We're committed to providing opportunities for county, through comprehensive prevention planning efforts. Counties across the state have taken monumental steps from shifting their mindset from being reactive to being proactive in order to support our kids and our youth and our families. That hasn't just happened through the Family First Prevention Services Act. It hasn't just happened through the continuum of care reform work. Those are central pieces that we've been doing in California for a really long time. We also have our 2083 work, which you may all know is a bill, AB 2083. We love to refer to things as bill numbers in California. I find that very confusing. AB 12 will always be AB 12. AB 2083 really refers to our interagency leadership teams. It was a bill that was signed into law in 2018, recognizing that child welfare can't go this alone, that we need our mental health partners, our behavioral health partners, our healthcare partners, our developmental services and education partners at the table with us through a coordinated system of care framework that emphasizes person-centered, culturally responsive, and trauma-informed approaches to the work that we're doing. Our children and families are not just interacting with our system. In fact, we're one of the last systems that they interact with. They are part of our education systems, our developmental services systems, our medical systems, our behavioral health and mental health systems, long before they touch our systems. So part of comprehensive prevention planning is making sure that we have that system-wide approach, that we're engaging those partners, and that we're finding ways to support children and families in order to prevent them from ever touching our system. And comprehensive prevention planning is just one initiative designed to support that work and transform our systems. The other initiatives across California are rooted in the belief that upstream approaches will lead to transformation for our communities in need. So we have implementation of the local community pathways for families to access services prior to a call being made, to the child abuse hotline, again, with the goal of sort of preventing the individual and the family from having to be directly involved with the child welfare agency, and allow them to have that interaction with their community-based organizations where they have much more connection and sort of support, and it's a known quantity. We're trying to shift from mandated reporting to community supporting systems. Again, it's a paradigm shift that's trying to make sure that instead of just reporting our families, we're looking at the needs of families and communities and figuring out how to more proactively support those needs, again, without sort of the interventions of child welfare becoming necessary. We have our Center in Family Finding engagement and support, which you have already heard about. And if you haven't, we have lots of trainings and webinars that we've done sort of promoting that work, and that's really focused on really how do we engage the whole of the family, again, as a prevention strategy, so that we are using those natural supports to support parents in order to prevent the child from being removed. But then if a removal does become necessary, to make sure that the first placement of that child within child welfare is still with their own family members, with their own relatives, the people that they already know and love and trust, with their own tribes. And so that work is underway in California. We have CalAIM, which you may know is a long-term commitment to transforming and strengthening our Medi-Cal system in order to make sure that we have a more equitable, coordinated, and person-centered approach to maximizing health resources and supporting the healthcare needs of our families and children. We have our California Child and Youth Behavioral Initiative, which is a multi-year, multi-department package of investments that's trying to reimagine systems, regardless of who's paying for those services, in order to support behavioral health of all of our children, youth, and families. We have our Essentials for Childhood initiative, which addresses child maltreatment as a public health issue and aims to raise awareness and commitment to promote safe, stable, and nurturing relationships and environments, and to create the context for healthy children and families through social norms change programs and policies. That is work that's very much centered around the use of data to inform the work that we're doing within that space. We also have our Linkages program, which is a collaboration between CalWORKS and child welfare to create a continuum of services to support our families that are within that CalWORKS system and make sure we're promoting child and well-being. Those are just a few examples of sort of how we as a state, in terms of our comprehensive work, are thinking about these strategies, not in a single way, but across systems and in partnership with the folks that are running other departments and other systems and delivering other services to the exact same families that are served within our child welfare system. While we pave the way together, we want to hear from you about how to bring all of these reforms together, how to get there in terms of really, truly impacting community in partnership in a positive way and centered around the experiences and needs of our children and families. I hope that this convening today will be inspiring and informative experience for all of us, and that you'll all take advantage of the opportunity to learn and collect and collaborate, not just over the next 2 days, but ongoing. We are here as a resource to you and very much are doing this work in partnership with all of you and encourage you to continue to reach out as we embark on this work together. So thank you all for organizing today's events and for inviting me to say a quick hello to you all. And I'll turn it back to whoever I'm turning it back to. Cheryl?
Thank you so much, Angie, for the inspiring words and talking about all the exciting initiatives happening in California. I really appreciate it. So if we can bring back up the slide deck. Thank you. We'll now move into our tribal engagement panel. So I'd like to introduce Lucy Hernandez from Strategies Technical Assistance. Lucy has an extensive expertise working with rural counties, especially in Northern California, and she'll be supporting the conversation today with our tribal engagement panel folks. As many of you know, throughout the state of California, Native American children and families are disproportionately represented in child welfare. And thus it's vital that tribes are an integral part of the comprehensive prevention planning and implementation to make real and lasting change. So I'll turn it over to Lucy to get us started.
Thank you, and good morning to everyone. It is, in the many years of working in this field, it is always exciting to see professionals, partners, providers come together to really align our work in a common goal, and that is to improve the lives of our children and our families in our community, in the communities that we live in and the communities that we work. So today we were having a discussion on how important it is to solidify relationships. One of the things that I always share with everyone I work with is that it is important to know that we are only successful based on the relationships that we have, because that social capital is really what allows us to streamline program and services to make a difference for our communities. And today we're talking about how to ensure that we understand, we can listen, we can learn, we can implement some of the strategies that our speakers are going to share on strengthening and solidifying our tribal partner relationships. So with that, I would like to get our panel started. First, I would like to have our 3 panel members share a little bit about themselves, the work they do, and I will ask Lisa, let's go ahead, and Lisa, if you can we'll start with you. If you can introduce yourself and tell us a little bit about your work.
Absolutely. Good morning, and thank you, Oriana, for the blessing this morning. My name is Lisa Parker. I'm the Executive Director and founder of Native Solutions Family Guidance Center here in Mariposa, California. I also serve our Madera County, eastern port of Madera, which is Oakhurst, California. So our agency is kind of dual. We have 2 locations, as well as our surrounding counties. Native Solutions also assists Tuolumne, Merced counties. We've assisted in different things. Native Solutions was founded as a supervised visitation center. We've seen the need in our community to assist with supervised visitations and the reunification of our families. And our mission was to provide a safe and neutral professional environment to allow children to maintain an ongoing relationship with both parents and strengthen that family foundation, as well as in our tribal communities. We've seen a very low number of reunification with our tribal families. And so we quickly seen that need and met that need within our community. But we service all populations and all ethnicities here at Native Solutions, not just our tribal families. And then quickly, Native Solutions grew very quickly. We seen the need, and our proactive need was also to assist parents with that reunification process, doing batters intervention, child abuse endangerment classes, parenting classes. And with those sanctioned programs, when the parents would come in, we would do the reunification. We also assist them with those classes so that they meet those needs to get the kids back. But we quickly grew. Native Solutions is just not the supervised visitation center anymore. We now have 2 state DUI programs. We're licensed through the state of California, so we also have the DUI programs, and that's strengthening the family's foundation to get their license back. Look at those barriers that were keeping them from, being proactive parents in the homes. We also opened up a sober living facility here in Mariposa County. And we engaged with a lot of our tribal partners in the beginning of the opening of Trade, and Trade was Trade One Life for a Sober Life. And so we're excited about that venture, I guess you could say. It's been quite an ongoing process with our community partners getting that up and running, but we are moving forward with that. So Native Solutions Family Guidance Center has engaged in a lot of different proactive measures to help families when their children are detained. One of the other hats that I carry here is I'm also the ICWA liaison for the Southern Sierra Miwok, who are a non-federally recognized tribe here in our community. And so with that being said, we seen the need within the tribe to have that voice in the courts with the children, to continue that voice with the child welfare services, with Mariposa County, with Madera County, with our surrounding areas. Whenever our children are detained, they didn't seem to have a voice being a non-federally recognized tribe. So we quickly jumped on board with the Southern Sierra Miwoks, and I carry that liaison, and I've been working with them real closely in the court system as well. And so I also carry 2 contracts, one with Mariposa and one with Madera. So I am connected with CWS. So we get referrals from them so that we strengthen that community partnership to allow them to be able to send referrals and get those parents engaged immediately with supervised visitations, parenting classes, whatever the need. Transportation, that's a huge barrier up here in Mariposa County. We don't have a busing system, so we worked closely with that to get them some transportation. So Native Solutions has become a very vital community partner, I guess you could say, here in Mariposa, as well as Madera, our eastern Madera County as well. But our base is with the Southern Sierra Miwok non-federally recognized tribe. And it just so happens today, I just want to do a brief mention that Oriana spoke about the land base today, and that's very important with the tribes and the tribal engagements. Today, Wahoga Wilson Cabin is being relocated. It's a great partnership with the Native, with Yosemite National Park Service. And that partnership also, today, the Wahoga Wilson Cabin was built in 1933, and it was being relocated now to their ancestral part of the lands in Yosemite National Park. In 1969, MPS evicted all of their native populations from that land base by burning them out of their land base. Excuse me, I get a little emotional there, but with those, they demolished all their homes. They kicked them and evicted them out of the Park Service by burning them out. And so today that original cabin is being relocated to the Wahoga Village. And so it's a very historical and symbolic event that's taking place right now. As we speak, it's actually being moved. So when you talk about land acknowledgement, that's very important to the Southern Sierra Miwok here in Mariposa County. So excuse the tears of emotion. One of the other things that we embarked on during the Supervised Visitation Center was seeing that the parents also needed assistance. Our monitors are not licensed clinical social workers. We're just supervised visitation monitors, but we've seen a need with the parents through the trauma. So we embarked on hiring some licensed clinical social workers and adding some therapeutic visits through our agency. So we're writing grants and supporting that portion of our program. And so with that being said, as a founder of Native Solutions Family Guidance Center, I can say that we embarked on a huge leadership within the community and just continuing to do proactive efforts. Like she said, instead of being reactive, we're proactive and trying to get these parents engaged in services immediately. So I'm blessed to be here today. Thank you very much for allowing me to speak and continue to do the good work. So thank you.
Thank you so much, Lisa. Just the passion, we definitely feel it, and just knowing the history of our land. And I failed to mention, I come from the land of the Nomalaki tribe in Northern California. Thank you so much, Lisa, for all your work and your efforts, and also the recognition of what is happening in your community today. Thank you. We'll go to Tony. Tony, if you can introduce yourself and tell us a little bit about your work. And I think you're muted, Tony. There you go.
Oh, there it goes. Okay.
Yes, we can hear you. Thank you.
Okay. Good morning, everybody. I'm very happy to be here today and sharing information with everyone. I work for Tuolumne Miwok Tribal Council. I am a family advocate in the Tribal TANF program. We provide cash aid to our families and a huge array of supportive services. We also have a cultural wellness program where we provide classes that are open to all Native Americans, whether they are TANF clients or not. We do it in the style of a family night gathering, and we provide all the supplies, and they work on Native skills and traditions. We've done basket weaving and drum making and sand art and all kinds of fun crafts that the families come and do together. Dinner is provided for everybody, and we do this in 3 different counties. We also have a career development center where we help people if they're wanting to work on their GED or their high school diploma, if they need help with resumes, interview skills, things like that. We have Jessica Silva, who is our coordinator over there, and she helps people with all of those things. The tribe also has a social services department where we have an Indigenous trauma specialist, victims of crime, domestic violence, and so many different programs and services that we can provide. I work closely with a lot of agencies in our community that provide other services, such as helping with childcare, which we also do, but And our biggest goal here, our first priority is no wrong door. When someone calls looking for help, looking for information, if I do not have the resources to provide the services they need, I find them someone who does. That's our first priority. And treating our families like families. I know all of my clients on a first name basis. I know all of their kids. I know when their birthdays are. I know what school they're in. It's very hard, I have found, working with the Native families, it's a lot of the times very hard for them to reach out and ask for help. A lot of them are not trusting of government agencies, and as soon as you mention anything about child welfare or a government agency of any type, they kind of back up and go, no, I'm okay, I got it. So the first and most important thing is making a connection with your families and making sure that everyone is comfortable. And that's what I spend every day doing, trying to make sure that my families are okay and they're taken care of.
Thank you so much, Tony. Once again, thank you. An example of the great work when we connect our passion to the work we do, we have these excellent opportunities to connect families and make a difference. So thank you, Tony, for sharing.
Absolutely.
Oriana, we'll move on to Oriana.
Okay, I know where our time is limited and we can spend, all our entire time introducing ourselves and all the many, many hats and responsibilities that a lot of us tribal workers do, right, within our communities. I'll keep it really brief. So again, Oriana Walker, hello. I'm the director of the Picayune Rancheria, the Chukchansi Indians. I, like so many other tribal representatives, tribal directors, tribal social workers, tribal advocates, we have so many responsibilities and we're often stretched very thin. Here within my office, I'm responsible for licensing both childcare homes and childcare and tribally approved homes for placement and monitoring those homes. We provide a childcare subsidy program through the CCDF. My responsibility as a director is going to seek grant funding, continuing to find all of the grant funding, staying up on the upcoming laws and all the regulations that come with different grants, writing the grant, reporting for granting, program building, finding the needs within our tribal communities and creating programs and addressing those, all while still servicing our tribal members and the families that I go to court for. We are the ER workers, we're the FR workers, we're the permanency workers, we're the advocates that go to court, we're the ones that need to also stay up with the family and provide the transportation, provide the supervised visits, sit in the IEP meetings, sit in the TDMs, CFTs and staffings and whatever other acronym there is to sit on. We're there. I'm advocating for our families. So there is a ton that we do. I don't think that there is anything that we wouldn't do. I am a tribal member within my community, so I see that if there's a need and I can help in any way, then I am happy to help, and the ICWA department is happy to help, and we want our families to feel supported.
Thank you. Thank you. And I really appreciate, we have so much expertise with our 3 panel members, and we have several questions for you. So we would definitely love to maximize the time we have together. And also the opportunity for many of our colleagues and partners, providers that are here today to connect with you. So we are definitely going to be providing your contact information. So let's start. Tony, I would like to start with you and asking you to start us off with the first question being, what stories of resilience and struggle come to mind given the families you work with? And then we'll move on to the next panel member to answer the same question.
Okay. I see a lot of, being in the rural area that we are, there are a lot of barriers with transportation, with employment, a lot of broken families, and there are services available here, but not everybody is aware of them. And I think that there needs to be more outreach and more making people aware of the services that are available to them. Because once you actually get in and work with that family and show them the things that you can help them with and the things that you're able to provide, it's such a change. I think the best way I can explain it is to give an example of one of the families that I worked with. This gentleman was a Native father. His domestic situation was not great. It was not great for him and it was not great for his children. So he decided he was going to step up and change that. So I get a phone call one day from a newly single father of a 3-year-old and an 8-year-old girl. And when he presented divorce papers and tried to get out of the situation with his partner, he was actually physically assaulted. So there was a restraining order in place. The girls were, custody was given to him, and he was starting over as a single dad on his own with 2 little daughters and no idea what to do. Because he had both of the daughters, he had a different schedule. There was nobody to pick them up. There was nobody to drop them off. They had to do school. There was no daycare. He was not able to work at that particular time because of that situation. They were living on his savings. And the first time I talked to him on the phone, he literally sounded like a drowning man. He was completely out of his element. I have 2 little girls. I can't go to work. I'm running out of money. What do I do? The first time he came to see me, he brought the younger daughter with him, the 3-year-old, and I met them down at the front door. And I said, "Hi guys, come on in." And he leaned down and he took her little hand and he said, "Come on, sweetheart, we're going to go in here with Tony." And the sweetest little face with the biggest brown eyes you have ever seen looked up at me and said, "Hi, Tony, you're going to help?" Right then, I knew that this was my job. This was the place for me to be. And this is what I wanted to be doing. Since then, I got him signed up with our program. I helped him work with the county to get signed up for EBT. I got the girls signed up for gymnastics. I got our domestic violence program to pay for his vehicle registration and start up his insurance. I got him connected with Columbia College, and he is now going to school to be an architect. The girls are healthy and happy. The household is doing great. And when you see him now, he's smiling. And to me, that is what makes this job what I want to do, is being able to, someone comes to you in crisis and being able to say, "Yes, I can help you with that." And then actually following through and seeing them do better and the family stay together and everything improve for them.
Excellent. Thank you so much, Tony. Excellent example. Oriana, can I ask you a question next? And that is, why and how should Native service providers, leadership, and families be engaged in prevention planning?
This is a big opportunity with the prevention planning that has come about to really identify communities that are in need and that need the help and that have the lack of services, the transportation, the we have a lot of culturally appropriate services. A lot of our culturally appropriate services don't meet that evidence-based criteria. So this is a huge time to really engage with the tribes to want to provide those services, something that hasn't been done. Think outside the box of how we can truly start to help our communities as a whole, and that would begin with engaging, within the tribal communities. So with the loss of trust, due to the history of the tribes and the government, it is important to understand the community and service providers you're reaching out to, and to know the history and to get an understanding of the hurt that was felt a long time ago. Understand that tribal governments are not only just an agency, that we're a structured community within our own laws. We have some tribes have their own courts, some have their own social service departments. It is a true for myself, I am a tribal member. So when these families that I'm helping, they may be a relative, they may be a cousin, but at the end of the day, my phone's always open, and at 5 o'clock, I'm still here. I'm still living in my community. And that goes before our tribal council too. Our tribal council, we're a small part in a larger community. Myself, our tribal council, and it's really important just to engage the tribal councils, the leaderships, at a government to government level, and give the tribes that respect and that time at the table, so that their voice can be heard. You know, engagement would look like, as I said it numerous of times, and I say it a lot, is we are so stretched so thin that we have so many responsibilities, and we want to be in every county's little CP, prevention planning meeting, but we can't. So how can we still be engaged if we can't be everywhere? So that may look like, providing extra efforts to reach out to, a tribe and say, okay, you weren't able to make it to our prevention planning meeting. This is what happened. Is there another time? This is an email, of an email, a call, a text, any sort of engagement, because it's not that tribes don't want to participate. It's just sometimes time does not allow for that.
Thank you. Right. Same question for you, Lisa. Why and how should Native service providers, leadership, and families be engaged in prevention planning? Your thoughts?
Oh, on so many levels, it's so important to be involved in the prevention of these levels. I think when I began this venture with Native Solutions, we noticed that it was a very reactive county instead of a proactive county. But we also, the prevention of getting the services to the families, assisting them in parenting classes, child abuse intervention classes, DUI, or lifting those barriers. With the non-federally recognized tribe, it was very important to remind the courts of the state levels, the state laws, the federal laws, even though they're non-federally recognized, they're still a tribe within our community, and these children are still Native American. They are still carrying the same bloodline as their ancestors in this land. And even though the tribe's non-federally recognized, they still have services that could assist those families, and making sure that the courts understand that we're here to support the families, and we're here to help these families so that they can reunify, provide trainings, provide education acknowledgement. I've sat within the judges' courts many, many times. I've been kicked out of the courts and I've been welcomed in the courts. But just reminding them that, they are still here. They are a non-federally recognized tribe, but they're in that process, and government, it takes a lot of time and effort to get federally recognized, and educating them in that process, is mainly what it took for us to get the community involved and understand that, if you have a federally recognized tribe in your county, you're going to have parents that have housing programs, tribes councils that are developing programs that are assisting these families to get back on their feet, or the betterment of their families, helping them with housing, education, helping their elders, with food assistance. I was a former tribal administrator for one of the tribes, and we helped build those programs on a federal level when they were federally recognized. So being non-federally recognized from that, helping that tribe, you understand that these programs are important to the community, not just our tribal families, it's in a community in a whole. Helping with the homeless population. It's tremendous work that, having a federally recognized tribe will encounter in the community. So
thank you, Lisa. And same question for you, Tony, and then we'll take some questions that I'm seeing in the chat. So Tony, your thoughts?
Well, as far as engagement, I have noticed since I've been in this line of work, if you are working somewhere like I am with our tribe up here, our tribe has a lot of things going on and they are federally recognized. They own businesses in the community. I mean, it's easy to contact them. There is a tribal hall you can call for information, to ask for programs, to go look for help. But we cover 3 counties, and that's Stanislaus, Calaveras, and Tuolumne. And we are based in Tuolumne. But then if you go out to Calaveras, we have a whole area out there in West Point where that tribe has been fighting for 20 years for federal recognition, and they have gotten nothing. There are no programs out there for them. There are no services out there for them. Nobody is helping them with anything because they're not on the map, so to speak. We provide the TANF program out there for them. That's one of the locations that we do our cultural wellness classes. We do things for the children every year. Every fall, we do our backpack program. We give all of the children in all 3 of our counties brand new backpacks filled with school supplies to start the new school year. There's different services that we can get out there and provide, but the difference between being here in Tuolumne and being in with that little group in Calaveras, like I said, here the tribe has a tribal hall. You know who is on the tribal council, you know who the leaders are, you know who to go to for things. And it's easy to reach and it's easy to approach. When you get into a smaller community where there is not the federal recognition and they don't have all of the things set up that we do, if you want to reach those tribes, you want to engage them and you want them to be part of your planning councils and have say on things, you have to get out there, you have to get into that community, you have to do like we're doing, the wellness classes and the events and the programs, and show them that you're not just showing up to say, hey, we need your input on this or we can't get what we want. You have to show them that you are interested in them and in helping them and reaching out and making a partnership. You can't just pick up a phone and call a building somewhere and say, hey, this is what I need. You have to build those relationships, and it's not something you can do over the phone, and it's not something you can do in 5 minutes. It takes time to build that trust and to get something going with those communities. But once you do, it's absolutely awesome. The cultural wellness things that we do out there, the majority of the kids that come in that area it's all the teenagers, because they are in a rural area. They're in the middle of nowhere. There's nothing for them to do. And they come and they're learning beading and they're learning drumming and they're learning all of the cultural things that we're bringing out there, and they love it. They love every minute of it. They show up for every class. They are super nice kids. They're super respectful, and it's a great experience for everybody. But we could not have just walked in there and one day and said, okay, hi, we're an agency and we're here to help you, because it's a small community, and they'd have been like, we don't know you and no thank you. But over time, we've built a friendship with that community, and now we're able to provide a lot of services, and they also give us a lot of input as to what they need, what they could use. Is there any way we can help them with this? So it's a back and forth thing, and it took time to get there. And that's what you have to put in, is the time.
Thank you, Tony. Excellent. And some of the things that you mentioned is it's not just picking up the phone and making a call, but what do you recommend? I know in some of the conversations when we were working on the pre-planning of today's panel, you had mentioned perhaps some advice, and that is, to invite the tribal leadership to meetings, and that it should be maybe the leadership from the organizations inviting the tribal leaders. Any other advice or suggestions that you have?
Well, in the smaller communities like that, like I said, not having a tribal hall and the whole government set up like we have here, you can't just pick up the phone and call somewhere and get a hold of the person in charge. So it takes doing events like we do, being out in the community and meeting people, and then you get to know who's who and who the local families are, because that's how I know the people out in West Point. It's not people that we just went, oh, this is the person in charge, so this is who we contact. We went out there, we started holding the classes, the families started coming, we met people, we learned which families were related to which families. And although they don't have a tribal hall and a bunch of businesses and everything set up there, there are elders, there is a group that kind of everybody else goes to for their information and their advice. And by being out there and doing the outreach that we do, we have come in contact with those people. So now we have the ability to contact those people directly and say, hey, we're working on this, or what do you think about that? But it wasn't something that we could just pick up the phone and find them. We had to be out there and meet everybody and learn who everybody was and their role in the community and go from there.
Thank you. And so I wanted to just maybe Oriana or Lisa, any advice or suggestions that you would give in order to create a relationship, in order to strengthen a relationship, if there is one or two things that you can share with the counties today, what would that be?
I would share just going out into the community, knowing what the community is, knowing who the community members are, understanding who is our tribal council, who are kind of like the key players, and just really engaging and having that meaningful conversation, not having it to be forced, not just, I have to call you, or, I feel like I have to attend, your dinner or your meetings, but truly wanting to be part of the community.
Excellent. Thank you. Same question, Lisa. You're muted. I believe you're muted.
We built partnerships with the counties. It was very important on our level to build relationships with our county partners and with their department heads, with Child Welfare Services, and in both counties, Madera and Mariposa. It was important to make sure that they understood that I was also their ICWA liaison for the Southern Sierra Miwok. Making sure that those liaisons are notified, making sure that they understand our role and what that role takes place, and staying involved within the community. Native Solutions not only provides all these services, but we were also a bridge during the disaster relief time when the disasters hit. That it was really important when the fires hit. We took place. My business became a shelter, but also making sure that our community heads understand our role within the community as well. I know on the tribal council levels, it's important, but I've reached out to many tribal councils and with assistance for just a Native child not enrolled within their community. I'm just saying, hey, there's a need. This family's, they're Native. Is there any need that we can help, and educating them on, housing. Your HUD levels cover all communities. It's the HUD levels for housing. You could assist these families. They don't have to be an enrolled tribal member within your community. You could be assisting them. So it's just making sure that they understand their role, and our roles in bridging those gaps within the communities is really important.
Excellent. Thank you, Lisa. So I know we're running out of time, and I just wanted to point out maybe one question, if we can just maybe at least answer one of the questions. We do have several questions in the chat, which I would like to ask the panel members if you feel comfortable us sharing your contact information and having our county partners contact you if they have some additional questions. Would that be okay with you?
Absolutely.
Excellent. Thank you. So the question that I would like to pose to the three of you is, do you provide any type of free training to other agencies?
I do offer a symposium on supervised visitation monitoring. So I do the 24 hours, which is required on a state level, but my training is actually 40 hours. I'm a certified grant writer. I also do grant consulting. So I have taught some grant classes in my spare time. So yeah, there is quite a bit of, I'm also teach parenting classes at facilitator level. So
excellent. Thank you. Tony or Oriana?
For mine, we do not, I do not teach any classes. Like I said, we have the Career Development Center and they do some things over there, but that is through Jessica. And then we have the cultural wellness classes. We have a wellness department that does that. And then we have providers that come in and hold the classes. But I am always happy at any time through phone or email to discuss anything with anybody if they have any questions about what we do, how we do it. what kind of assistance they can find through us, that kind of thing. Anybody that has questions that they may want to implement some of the things we do in their own programs, anything like that, I'm available. Anybody can contact me with any questions they have.
Thank you so much, Tony. And Oriana?
Yes, and I know a lot of resources that if there's something that I can't help you with, then I have a resource for it. So please feel free to contact me with any of your questions, any of your training needs. I could be happy to link you up with resources.
Thank you. Well, I want to say thank you so much to the three of you for sharing your passion, the experience, your involvement in the hard work that you're doing, and on behalf of children and families, and sometimes families that have no voice at the table. Thank you for also your contributions and your county planning efforts, and also for sharing your expertise with county agencies that are going to be contacting you. As I mentioned, there's several questions, and I wish we had more time. This is something that I know we could be talking, we can use half day to talk about this topic because it is so critical. But once again, thank you for your time. And I hope that for all the counties and all our partners and providers that are here today, that you can take away one tool, one strategy that you can incorporate in your CPP planning, in your county work, and also knowing that now Lisa, Oriana, and Tony are part of your support network. So with that, thank you, and I will be now transitioning it back to Sarah. Thank you, everyone.
So much, Lucy, Tony, Oriana, and Lisa. You all are fabulous. We really appreciate your time and energy, so thank you. We're going to move forward with our next panel, which is our lived expertise panel. So I would like to introduce Alyssa Burke, who is the CAPC coordinator for the Western Nevada County and has also been a part of the convening planning team for the last several months. Alyssa was so kind to do the panel moderating for today, so I will let her take it from here.
Thank you, Sarah. Good morning, everyone. Again, my name is Alyssa Burke, and I'm the CAPC coordinator for Western Nevada County. And today I have the privilege of introducing our panelists with live expertise, and I'm very excited to do that. Today we have Gladys Mitchell, who's a parent partner and program manager with Victor Community Support Services in Stockton. We have Robert Rogers, who is a family specialist, MHSA, FSP program Family Care Network. We have Lorena Molina, senior parent partner from Riverside University Health System. And we have Katie Carter, parent with live expertise. And we have Mia Carter, a youth with lived expertise. So again, it is my pleasure to introduce each and every one of them to you today. And Gladys, if you could please start us off. Our first question of the day today is going to be, please tell us how your involvement with the system has impacted your family.
First of all, good morning, everyone. Can you hear me? Well, it's been a bittersweet experience. I can honestly say that I am very grateful for my experience with the system because I had no really understanding of what I was getting into when my son at 13 started showing signs of severe mental illness. And so my son was actually a school placement, and he had to be placed into a group home at the age of 13 and a half. And that group home was Victor Community Support Services. That experience in getting him there was sad, confusing, filled with lots of doctor appointments, law enforcement, courts, social workers. So the experience in itself at the end was helpful because my son's safety was first and foremost. The bitter part was trying to understand what I was going through and navigating a system where there are biases because you are talking about, unfortunately, an African-American youth. As I look back and I read notes that were in his file from the various systems that we interacted with, some of those biases were probably implicit or not even recognized at the time because I was a pretty savvy advocate for my son. Being, I have a master's degree in social work and mental health and absolutely no experience going through this. And so it was just the trauma of his behaviors and the interaction with those systems that really brought a lot of confusion and sadness to my home because the whole goal was to try to figure out what was going on and then to have my son in a safe space. And there were many people along the way, particularly from the school district, the SELPA and the ERMS coordinator, who really, really, really helped me by being empathetic and transparent, understanding, and kind. But there were a lot of people also along the way who were very biased, who had just a not understanding, a clear understanding of what was going on with my entire family. But because of I think my sense of advocacy and my desire for my son to be safe, I sat at the table from top to bottom, leaders and non-leaders. I was very good at to get my son the appropriate help that he needed. But it definitely was a journey that I don't wish on any family. And because of my experience with the system, I learned to share with other families what to expect, what to look for, and to even note that this is not just behavior, this is something a lot more serious. So I guess in short, I can say that the impact on my family was bittersweet.
Thank you so much, Gladys, for sharing. We greatly appreciate it. Roger, if you could share with us next, again, tell us how your involvement with the system has impacted your family.
Yeah, my experience has been, yeah, it's one of those situations that I don't know what I would have done without the involvement that I received from child welfare and the other programs I've been attached to. My life 8 years ago was very different. I was homeless, suffering through addiction and divorced and away from my 5 children, and my circumstances were pretty dire. I felt in my world, and child welfare had brought me in to let me know information about a SCAR that they were investigating, and it was noted that I was using substances, and they had offered support in treatment, and I accepted that support, and it was shortly after when I was in drug and alcohol services, my children were removed from my ex and put into the system, and my son was identified having those extreme behaviors and was hospitalized at the age of 6 for a month in Bakersfield, California. And it was very hard to experience that. And through that, that's when I experience was introduced to RAP services and the whole mental health part of the system. And I had a team around me that really helped support me and educate me, provide me that guidance that I needed and the tools to help my son and understand his needs, as well as, in a sense, reset my own personal life and the choices that I had made and where I was at. And they really embraced that trauma-informed care approach with my family. And from that, nothing's perfect right now, of course. I still have that same son with specialty mental health services, and I'm a single parent. I have 6 kids in the home, and well, I should say 3 have moved on and they're older now. One's in college, one's still figuring out life, and the other one is about to attend college in Long Beach. And but I still have 2 more children again that are receiving specialty mental health services, and the one thing that I was given is those tools on how to process their needs and understand their needs on a completely different level. And through my child welfare services worker and the rest of my team really helped me and give me that encouragement that I can get through it, especially in early addiction and in those early times when I was doubting myself and my own judgments and in my direction and where I was going. I was always given that encouragement that I can do it, that I'm better than what I was made out to be, or with what's written on paper. I'm better than that. And it was life-changing. I don't know where my family would be without the involvement excuse me, without the involvement of the system and child welfare and the community supports. I work for the agency now that supported my family with RAP services, and to come back full circle, being in the role that I'm in now in specialty mental health, I get to share that part of my story and in the experience that other families are going through with mental health with their children. I can, truly tell them that they can get through this, and this is how to do it. So some of the things that really I was given is that will to continue and to move forward, and then to help along those other families. And my motto is if I can help just one person, get through with what they're experiencing, then my experiences was worth it. And so it's definitely impacted me in a lot of different ways, my mental outlook, and how I go about my day, and how I live with that integrity and with what I do. And I take great care of that.
Thank you so much, Robert, for sharing. Greatly appreciate it. Okay, our next speaker, Lorena.
Hi, good morning, everyone. So my initial involvement with the system, my children were actually in foster care in 2007, and it wasn't a very positive experience for us. I think for myself and my children, we experienced a lot of trauma during that process. For myself, I think the hardest part was not really being seen and really looked at for, what had happened and what had got me here to the place where I was at. And then with my children, they faced a lot. They went through a lot of trauma. I think through the initial removal and then going into foster care. And while they were in foster care, waiting on that kinship to take place, it was then that they experienced a lot of physical and sexual abuse during that experience. And so for us, it was really hard. We didn't really have the support I feel that we needed. And so we did get a lot of support, though, through our community partners. So it was through the community partners that we had, church, the daycare centers that my children were in, because we were very involved in our community, that they got a lot of support. We got a lot of support in that way, in that aspect. When I was able to reunify with my children, I think that's where like a lot of things kind of manifested. I had to deal with a lot of, them feeling like they could trust me to share what had happened to them with their experience in foster care, what happened in the home when they were with family relatives, and then being able to kind of navigate through that with them and really get them the support that they needed, because they went through foster care for several years and never received that support. I feel that they were in fear to utilize their voice because they didn't have anyone empowering them on how to utilize their voice, how to share these things that were happening to them. I think that if they would have had that, they would have been able to have a better experience with the foster care system. And so for us, unfortunately, I hear my other colleagues here today that are sharing, and, some experiences are great. Some people have the right support, they have the right, systems in place and the right working partnerships and the right community partners. And for some, it's not always that, it's not always the case. And so for us, it was really, if it would have been different, maybe our outcome would have been a little bit different. And now them as adults, they're still struggling with being able to process a lot of what they had experienced when they were in the system. And then being a mom now of adults, and really seeing them are trying to fight now as adults to overcome what they experienced. And we see that a lot. And so that's why I do what I do today. That's why I'm here, is to help those families that are experiencing the same thing. Thank you.
Wow, thank you, Lorena, so much for sharing. And my heart goes out to you, to each and every one of you. And I just want to pause for a moment and just kind of put this out there that each and every one of you parents and youth who are sharing today are extremely brave and resilient. And I appreciate each and every one of you. It's not always easy to share one story publicly, but I thank you so much for doing so and being able to give back to communities in ways that you feel are best. And so thank you again to each and every one of you. And also that at times there can be some things, emotions or triggers that come up. So just to encourage everyone to take good care of yourself during this time. And with that, we're going to go to Katie, our parent with lived experience, and Mia, our youth with lived experience.
Yeah, so I didn't really have such a good, experience with the system at all. It all started from here by say, and next thing you know, they're at my door and the kids just, their dad gets taken for no concrete evidence ever to take him out of the house, and they were only allowed to visit twice a week, which was 30 minutes at a time. And it was really actually emotionally draining for me because I felt so alone in that situation. And I mean, we were in it for about a year until we moved out to Sacramento County, and the judge had literally just closed the case because he didn't even know why we were in it in the first place. And through the whole time, that whole year, I had to tell my kids, Dad, you get to see Dad in a couple more days. And whenever they wanted to see their dad, they couldn't. And they were more worried about if Dad was doing what he had to get done. And here I'm staying up late with my kids at night. And this one right here, she has social anxiety. I mean, to this day, I'm still trying to, tell my youngest, who is afraid that, I drop her off somewhere that, I'm not going to be there to pick her up, or Dad's not going to be there. And I have to walk her up every day to her school because she'll have this emotional attachment to where she thinks I'm not coming back. So, I mean, it's a struggle. And I felt like if we had more evidence that was looked through and I was heard, then maybe things would have been better and they wouldn't have to go through that traumatic experience at all. And they're still dealing with it as in their teenagers now. So it's just, I didn't like it. My husband didn't like it, and yet it's over now. But the fact that we still have to deal with those emotions still, I still feel alone. And it's really hard to tell a young kid that. Thank you. Your turn. It's okay. Go ahead.
It was kind of hard when I was young, living with my dad, knowing that he used to drink a whole bunch and work a lot. And it was kind of hard going to and from school. He went to rehab, knowing that I couldn't see him when I came home and I couldn't say good morning when I woke up. But I felt like the visit should have been longer when we visited him, because I would cry my eyes out at each and every visit at the end when we were done with those 30 minutes. They went by like nothing had happened. And it was really hard because without a father figure, I felt like I tried putting myself to be that father figure for my siblings, yet I was so young, and I just wanted them to grow up to be, you know, good people. And it was kind of hard because he wasn't there for us. So to this day, we haven't built a good relationship like most children have, but we all have with our mom. And it was kind of hard seeing him like that when we were young.
Thank you very much, Katie and Mia, for sharing as well. Our question 2 we're going to get into is going to be, what suggestions do you have that might have improved your experience? And Gladys, if you could start us off with question 2, that would be wonderful. Thank you.
I think, so right now the state is doing a lot with family finding. I think that, you know, families aren't lost, families just aren't seen. And so as our speakers discussed, you know, just seeing families in their situation and when they're in it, as opposed to seeing families through diagnoses, seeing families through you know, the systems lens. So I think if we ask more questions up front, the more of the why, and you know, like, what happened, how did we get here, how can we help you now, as opposed to having the system has its own answers for our families, to include mine. And again, I was, you know, I cry sometimes when I tell the stories, sometimes I don't, because I'm really a strong advocate for families who cannot do what I was able to accomplish, or what Robert was able to accomplish. So what I really think would make the difference, not just what would have made the difference for my family and all families, is that when our families come in contact with the system, that first of all, the system present itself with empathy and would see in us, because we don't really ask for these situations. Believe me, we don't. So if you ask us, how did we get here? How can we help you? What is your need right now? As opposed to these monumental delays, these broken communications where it takes, you know, we don't know where to go. How do we get help? Who do we call? I got to go through 50 million scenarios to find the right one. And I tell people, you know, if you call the IRS in California, you call the IRS in New York, you're probably going to get pretty close to the same thing, because the system is very connected. But here, for some reason, in mental health and child welfare, that's just not the case. And so that's why it's so important for people like myself or Robert or Katie. We try to share how to get to the other side and make that experience as humanistic as possible. So my ask would be, if we can just get workers that just show some empathy and understanding and see families. And I get it, you know, judges make these decisions, but even judges need training. So that would be my suggestion on how to improve my experience, is to see, you know, to have seen my son as a boy who was getting sick versus this thing that was a disruption to the entire system.
Wow. Thank you again, Gladys, so much. I feel like that's such helpful information. And again, appreciate you sharing in your vulnerability. Robert, if you can answer. Thank you.
Yeah. Early on, when I was when my case plan was set, and you know, I went to work on that and in meeting everything that was expected of me, and the last piece for reunification to move forward and the 30-day visitation was housing. I was currently in sober living, and I you know, finances were very limited. You know, at the time I didn't have a great paying job, and the way the system was in some of the community supports that could help me with housing, I couldn't access because I couldn't get housing without the kids, but I couldn't get the kids without the housing. And I was just in this really horrible loop of and I didn't know what to do. And it was very hard to experience that. And of course, housing and the housing crisis and affordability in across the state, especially in San Luis Obispo County, is no different from many of your counties. And it's really hard, and it's very expensive. And I didn't know how to get out of that, apart from just looking privately to renters. And I was fortunate that I was able to get approved. Gosh, folks, my kids were in foster care for about 18 months, and it was we were going to court January 27th of 2017, and December 21st, I got approved for an apartment 4 weeks before the kids were going to be fostered out into the system, and I was going to lose them. And my team never gave up, and we continued to battle through it, and we found housing. And it was, and if it wasn't for that, the kids, this whole situation would have been different. But the community that I'm in really helped support me in getting that housing. And they came home December 23rd, and not to get emotional about it, but my gosh, that was just an amazing Christmas, because everything that we had been working towards for so long and so hard, and the hours and the visitations and everything I was going through, and drug testing and I have 8 years sobriety just last month, and it was just hard to have that finally come together in that moment, and I'll never forget it. But how can we help families with housing, and especially in those situations where just no fault, I was working as hard as I could, but how can we help those families get to that place of housing, and to be able to bring those families home? And it was is the only thing that I would see that really needs to be fixed, because it's a hard one across the state. But in my circumstance, we were that close to losing them, and unfortunately, just God bless his path that he put me on, and brought me to this place, and it was got me that place of housing to bring the kids home.
Thank you, Robert, so much for sharing, and congratulations on your 8 years. That's amazing. Lorena? Lorena, I think you're muted.
Sorry about that. So I think what would have helped improve my situation is just like Gladys said, you're looking at what has happened to lead the families where they're currently at, really taking that human approach to really connect with the people that are involved in these situations, really being able to hear what they're saying, and take it and value what they're saying, because they know their situation a lot more better than what people that are coming in and just seeing the aftermath of their situation, and it's important, that we have that trusting relationship, that we can feel that we can trust you with what we're going to be putting out there, and that we're going to be seen as a human being for those situations, whether it's something that we have lived before and it's a repeated cycle because that's all we know as parents, or that's all we know as individuals. And being able to really connect on that level and say, you know what, I hear what you're saying and I value what you're saying. What goals do you have? Rather than just putting on recommendations right away. These are the recommendations that we have for you, but really looking at the family and trying to find out what goals do they have, because they might have really good intensive goals that they have that might be similar to the recommendations that you're already suggesting to them, but it might look a little bit different for them, and really meeting that immediate need, because sometimes it's like, okay, we got all this stuff because this is what we have to do as an agency and this is what the protocol we have to follow, but really looking at that immediate need for that family that's coming into the system, really looking at is therapeutic services and peer support needed immediately to this response, because a lot of times, you know, what I see or what I've even experienced is sometimes families cannot connect with the social worker. Families cannot connect maybe with a therapist, but they might be able to connect with someone who's been through the similar challenges that they're facing, and being able to feel like they can build a relationship and take those people with them through this process. And whether that looks like a peer sitting in those therapy services, those sessions that they're having, until they feel comfortable enough that they build that trusting relationship. Whether these people need to come into having those supervised visits, going through the the maintenance process, the reunification process. If I would have had a parent partner, and I don't say this just because I do the work, but if I would have had a parent partner, someone who went through the similar situation that I did, I think I would have felt more empowered to not have to feel like I had to wait and not say anything, and just being able to utilize my voice. And I feel it would be the same for children. If they have somebody that is there to advocate for them, to empower them to use their voice from the beginning, they're going to be able to speak. And because children are so innocent and so resilient that sometimes they will say things and people will overlook what they're saying because they don't fit, because they're a child, they don't really understand what's going on, or maybe this is just something that maybe they're making up. But really looking at that, because children are very candid to say the truth, they're very candid to really say what's happening with them. And I think having those youth partners or those people that they feel that they can trust enough to say, you know what, I'm safe and I can talk, I can speak, and I can use my voice. I think we need this from the get-go, from the very beginning. It has to start at the very, the very beginning of the process, because being in placement or being removed from the home is a very traumatic experience for the whole family, and they need to be able to know how to process that from the very beginning, and know that they can even trust the process to get to where they need to go, and be able to really voice, this is what I want to see happen. This is where I really want to be. And this is what I need to get there. How are you going to help me get there? And I think that is, vital when we look at, services, and partnerships are huge. Being able to collaborate, being able to really say, you know what, this is what we're seeing on our end. And, I know that you've experienced this and this is what you're seeing. How can we work together to really look at that goal or that need that we're seeing as a team? And how can we come up with a plan to make sure that these families are getting what they need? I think that's huge. I don't see it a lot. Sometimes it's very hard to collaborate. And, the system has come a long way. I can say that, yes, it's come a long way, but we have a lot more work to do. And I think that it begins with our partnership, and it begins with the people that are involved in these cases from the very beginning.
Thank you, Lorena. Katie and Mia?
Yeah, I'll have to agree with you on that, Lorena, because, if I feel as though if we were, just heard, and my kids were heard when they said, why can we see daddy, more than 2 days a week? They weren't really seen. We did, like, our worker we didn't connect with them. And all they did basically was come in, and I felt like they didn't see my kids. They just kind of saw through them, and I didn't really, I wanted to have more of a bond with them. I wanted them to understand what we were going through at the same time. And I didn't get that. I really didn't. I mean, if we had more caring and more time with the kids, with their dad, I mean, those are moments I can't get back. Those are times I did alone, a lot of days alone without dad. And they don't have a relationship to this day with them. So, and they struggle every day just trying to, get one with him. And they lost so much of it. I cannot get that back. So I hope, a little bit more time and just listen to the kids, listen to the mom, be there for the mom too. It's not just the other parent that's going through it. I felt so alone. I want someone to, kind of guide me and say, hey, it's going to be okay at the end of the day. But I didn't feel that. Yeah, your turn.
There were a lot of people who offered to help us, like family and a couple friends, but only a few of them helped on my dad's part of the family because he was having a rough time. But it was hard seeing my mom doing all this and that without my dad being there to be another parent. And I felt like our visits had been longer, and if they were longer when I was younger, then maybe we would have had some sort of relationship, even just a slight relationship with him to this day. But I mean, it was very hard seeing my siblings grow up the way they did without my dad really being there, working all the time, going to rehab when we were kids, and all this. But I was glad that we had some sort of help from family and friends. And it was much better that we had that slight help, even though he was gone and out of the picture for a while.
Thank you for sharing, Mia. We have just a little bit of time left here. We have some questions in the chat, but again, I just want to say thank you to each and every one of you panelists today that were extremely vulnerable and brave. And I feel like each and every one of you are extremely inspiring and that your stories are very moving. So thank you. Robert, there's a question in the chat today and again, we have just a few more moments, asking what programs specifically helped you out of your housing situation?
Mainly, my son was receiving, as he was in foster care, services from the nonprofit agency I work for, Family Care Network, and because we were the goal was to reunify the children with me. And to open up RAP services. So he was attached to RAP, and my parent partner and I, we hit the pavement, and we were looking all over the place for housing. And so through RAP services is who he was attached to, and put in that time and dedication to me. And it's how we were able to find the place that I'm currently living in now. And then the community supports. I was in sober living. I didn't have any furniture, so the community came together and furnished my whole apartment, and it was amazing. And that Christmas again was very special. But it was RAP services and child welfare, through child welfare, that was supporting me in this process.
Well, that's wonderful. Thank you. And again, so glad that you have those resources. Let me see if there's any other questions in the chat that I might be missing.
There is one, Alyssa, if I can call it out for you.
Absolutely.
Because I think it would be so crucial for these folks to answer it. How much is too much information to give to parents and families early in the engagement with the system? They talk about parents often feeling overwhelmed, and family resource center services may not be received receptively with everything else that's going on in their lives. So how can they build a better bridge?
So this is Gladys. I'll take that, because I think every family is different. And so the professionals, these are the people who, they come in the door with all the answers. So I would ask the professional to use your professional judgment and pace yourself with your family. Take your cues from your family. Ask your family, how are you doing? Where are you right now? Are you overwhelmed? What else do you need right now? See the family. That's just so important. So every family is different. Some information, for me, more information is great. For someone else, that may be a little too overwhelming. So I would say, social worker, caseworker, ask your family. We're talking basic communication 101. And so that would be my response to that. But at least have the information if you're going to ask the question, or at least be willing, like Robert's RAP person did. They hit the ground with him. Be willing to do the work, because that's what it's about. Be present along the path, because it's not linear. There's ups and downs. So thank you for that question, because that would be my response. Just no information is bad. Just keep asking the family about how is this working for you? So that's my response to that. Thank you.
Thank you, Gladys. I believe that's all the time that we have for questions today. But again, thank you very much, each and every one of you. And Sarah, I will turn it back over to you.
Thank you, Alyssa, Lorena, Robert, Katie, Mia, Gladys. Thank you all so much for sharing your stories. It takes incredible strength and courage and vulnerability to do this. So you are all incredible people, truly appreciated, and thank you. Gladys, I have your quote, families aren't lost, they're just unseen. I think that couldn't have been said any better today, so thank you. We are, I believe, at the point of taking a break. And so please take a moment, stretch, take some deep breaths, do a little self-care, and we will come back. Let's do just 2 minutes after 11. Thank you all. All right, folks, welcome back. We'll give again another minute or two. So we have the full group here, and then we'll get started with the last portion of our day. Great, looks like we're, I think, close to 600 when folks went into their breakouts. So let's see if we get the majority back. All right, well, welcome everyone. We'll get started in the interest of time. So hopefully you enjoyed your workshops. They were informative. I hope as you got to share with each other, meet some of your colleagues, and all the workshops have been recorded today, and those recordings will be made available shortly. So we will get those to you in the next few days. So I'd like to transition to our last speaker for the day, or presentation, I suppose, from Roger. Roger is going to talk about the PEI Community Pathway recommendations. So Roger, when you're ready, take it away.
Thank you very much, Sarah. It is a privilege to be here with you all. I thank you for the privilege of being able to be in the beginning and now the ending piece, right? So I do have the privilege of being able to bring the PEI Community Pathway recommendations to you all. And so one of the things that I do want to share is that I have been humbly honored to be the co-chair for our task force, along with Dana Blackwell from Casey Families. And so, and of course, being part of the PEI with our fearless leaders, Catherine Eisenhower and David Swanson Honger. And so I was just in their workshop and just heard some wonderful things. And so I'm going to be sharing along the lines of what we have going on, just to bring out these recommendations. But I do want to bring up front this. I am a father who has lived experience. I navigated the child welfare system, and along with a lot of the individuals here today, I see you, I feel you, as I had my moment. And this right here that we're going to be speaking about is a passion of mine because of, if you want to say, I was impacted by the mandated reporting piece as well. I'm not going to get into the story piece about it. Our family made it through, and like a lot of other individuals that came from the outside sources. But I do say that if there were some things that may have been done a little differently, then possibly my scenario may have been different as well. So, but with that being said, I'm also not here to say that we need to do away with the child welfare system. For the years that I've been in child welfare as a parent partner, I've learned both sides. As a parent who has navigated the child welfare system, the feelings and emotions, the trauma, the pain, the aftermath, and everything that had taken place. But I also took time to go into the child welfare system to learn about it, to learn about my colleagues and the responsibilities and the heaviness. And so when this came out, it really impacted me in such a way to where I looked and I was just like, you know what, this is a perfect opportunity, because not just our families, which while we're here, how do we change the preventative piece, but also for those who are in child welfare, our social workers, supervisors, and so on, the impact that takes place. As a parent partner within child welfare system, within the child welfare agency, I've not only carried my own trauma to work every day, but I've carried the trauma of the parents that I served, mom and dad, and also social workers with all of just everything that's just put on top of them. So I got to see a different perspective as I was navigating myself and working with other parents and social workers. And so I feel that this here is vital for us as we're going forward for both parents and families, but also for the child welfare system, our social workers who are overwhelmingly carrying a load, not to mention the decisions they have to make, the court reports, and just the amount of what's taking place. As I shared, as it was shared earlier, I'm also a trainer and I trained across our state. So this is not something just within my county that I've seen, but also throughout the state working with child welfare in the trainings that I do, specifically on father engagement, but doesn't matter what training, I've seen that perspective. And so if we can go to our next slide, I'd like to get into this. And so the recommendation core tenets are California's vision for child, family, and community well-being is centered on equity, social justice, and respect for tribal sovereignty, and requires an approach that is dependent upon the successful implementation of a comprehensive prevention plan, CPP, of course, in each county. The CPP must be co-created with individuals, parents, and families with lived expertise in order to build a community pathway that is available for families to access culturally derived, appropriate, relevant, and responsive services and supports that are located in their community from organizations and community partners they know and trust. And so this piece right here, it's really, really something that we're looking into and trying to be inclusive, because not every single organization or agency, should I say, falls under the ability to be able to be evidence-based, but yet so impactful. And this includes the faith-based community and other partners that are in there. So success will only be realized in current practice and policies regarding mandated reporting and responses to child abuse and neglect allegations are dramatically reformed. Next slide, please. So recommendation 1, shifting the focus, implement a statewide mandate reporting to community supporting task force. In alignment with the recommendations of the California Citizen Review Panel, by July 2023, the task force shall be implemented under the auspices of the Child Welfare Council with oversight by the PE committee and in partnership with CDSS. It will lead a coordinated statewide effort to reform the mandated reporting system in order to avoid child welfare system involvement for families and can be supported in the community. Task force goals are to provide guidance and actionable recommendations regarding 1, legal and legislative reform, including setting limits on liability and narrowing the legal definition of neglect, redesign of mandated reporter training to shift and focus to child safety and address disproportionality, implicit bias, and the consequences of over surveillance, and the policy and practice reforms necessary to implement the change. Now, with all of these going on, we are carefully taking each step at a time. So it's not something that we're rushing into and trying to throw things together, because we know that there has to be that balance. And so, that's something that I do share as being part of this task force, is that we're working on this going forward, and we're slowly but gently going in, right? We're keeping everything in mind and really just keeping in mind every single thing that is important in what we're doing. The task force shall provide quarterly updates and a final report. All reports will be delivered at Child Welfare Council meetings. The final report will be delivered at the end of fiscal year 2020, from 2023 to 2024. So next slide. Recommendation 2, accountability oversight. Community pathways will only be successful if they are built by and for families in the community with an intentional focus on communities impacted by disparities and disproportionality. Resources and supports must match the needs and assessed of the community, but accessibly and culturally responsive, and be available from community partners that families know and trust. So this is one thing that we're also looking into, is how we can be inclusive from those who are community leaders who have lived experience, and making sure that the voice of the lived experience and those who are in the communities are coming in. And so that's another work that we're looking at doing, and taking it slow as we begin to develop. There needs to be planning and oversight specific to the community pathways at both the state and county level that incorporates youth and parents with lived expertise, community residents, and community partners. Therefore, we recommend a state community pathway advisory group be established as a subcommittee of the state's FFPS advisory committee. Further, the state should encourage all counties implementing a community pathways to provide the accountability and oversight of services and outcomes achieved in alignment with local systems of care integration, AB 2083. Next slide. Recommendation 3, consistent definitions. California should develop a statewide community pathway implementation framework that ensures access for all families regardless of FFPSA candidacy and/or eligibility. While each county requires flexibility, core components are necessary statewide for achievement of the state's vision, inclusive of consistent definitions and identified outcomes that are informed by individuals with lived expertise, community residents, and community partners. We recommend these core components include no wrong door, build on and integrates existing resources, defines the roles of public and private cross-system partners, equitable access and services, build on community and lived expertise, supportive of the protective factors. Next slide, please. Recommendation 4, financing. Financing the community pathway requires identifying resources and funding that supports an equitable continuum of care, knowing how to blend and braid that funding and create equitable pre-occurrence and claiming methods so all community partners can participate in community pathway delivery. For counties to implement equitable and accessible resources and supports, they must be intentionally in their financial planning. To help counties be successful, and the state must provide guidance and support and assist with eliminating barriers. We recommend counties conduct community pathway inventories that focus on resources and funding unique to their communities. Every effort be made to build on existing resources and services. Counties incorporate strategies that develop infrastructure and support sustainability, equity procurement. I can't even read. It's the end of the day, right? It's lunchtime already. Strategies so non-traditional partners can participate. Community Pathway Advisory Committee advise on decisions regarding reimbursement and funding allocations. The state provided clear definitions and guidance on concepts that impact financial planning, such as payer of last resort and imminent risk. Next slide, please. Recommendation 5, measurable outcomes of well-being and accountability. In order to determine in the community pathways is effective and generating better results for families, there must be a mechanism to continuously determine if children and families are better off than they were. In addition to require FFPS data, outcomes should include expanded access to community-based supports and services, formal and informal, partnerships developed or enhanced among key community partners, families getting access to what they want, when they want it, and impact of community-based services delivery, items 1 through 3 on child welfare involvement. To do so, we recommend the state and counties implementing a community pathway, work in collaboration with Community Pathway Advisory Committee to develop key indicators of success that are informed by parents, youth, and family, and children with lived expertise and community residents. Incorporate the voice of parents, youth, and children into the data collection process. Ensure the ongoing review of data to assess progress on outcomes, as well as adjustments and or enhancements needed. Next slide, please. Recommendation 6, services and practices. Community pathways should include evidence-based practice, as well as primary and secondary services and supports that are reflective of and tailored to the needs and strengths of families and communities, as advised by stakeholders, including those with lived expertise. Critical to this service array is 1, support the counties and community partners to promote staff training and capacity building to successfully implement selected EBPs, the integration and expansion of primary and secondary services and support. 3, cultivation and identification of community-defined best practices to cultural responsive EBPs for future inclusion in the state FFPSA plan. To do this, we recommend the state support the training and technical assistance required to effectively deliver EBPs. Community pathways include services and supports that target the needs of all families, with emphasis on building the service capacity and grassroots partners. The state used community pathway success indicators to identify evidence for community-defined evidence-based practices for future inclusion in the FFPSA plan. State level training and technical assistance continue to support and coordinate FFPS services. Next slide, please. And recommendation 7, training and technical assistance. The state should provide training and technical assistance to counties specific to community pathways and in support of implementation of all recommendations stated in this package. Any technical assistance provided should be available to community partners and community members involved in planning and development. To do so, we recommend the state include accessible training and TA infrastructure, develop a central training and TA support infrastructure accessible to public systems, community partners, tribal families, and individuals with lived expertise. Usability, ensure that training and TA recognize and address the need for varied audiences, users to interact with, learn from, and develop capacity together. Vendor selection, utilize an advisory process that intentionally leverages the expertise of the state's Community Pathway Advisory Committee. Alignment of training and TA content with FFPS vision. Prioritize existing strategies that promote integrated systems and services approaches. Oversight and accountability. Utilize the state's FFPS Community Pathway Advisory Committee to guide development and oversight of these strategies. My apologies for the quickness of reading through this and all that. I know we have only a certain amount of time. And so I believe that's it. Next slide. So right here, please enter your questions into the chat so we can provide more information via email after convening. So with that, as I shared before, thank you for the opportunity to be able to read these recommendations as we are continuing to go forward and working on them. And so with that, Sarah, I'm going to turn it back over to you.
Roger, thank you so much. I know it's an incredible amount of information to cover in such a short period of time. So there will be more opportunity to interact with the recommendations as they apply to plan implementation tomorrow. So in the interest of time, I'm going to go ahead and skip past the agenda for tomorrow, because you can find it in the Google folder under the agenda section. And I would like to bring back Oriana Walker, who is going to close us out with a tribal blessing. Oriana, whenever you're ready. We have Oriana still with us. She might have had to step out. So I'm going to go ahead and move past this piece. And just to say to everyone, thank you so much for attending. We really appreciate your time and your energy today. We would also love your feedback about how the day went today. We'd love feedback on the workshops, and you absolutely will get the recordings and all the materials from the workshops. Give us a few days to get them from the facilitators, and we'll be able to provide them shortly after. So thank you again. Any questions you have, please feel free to put them in the chat, and we'll do our best to address them after today, and we look forward to seeing you tomorrow. Take care, everyone.